Good afternoon, everyone. I'm Dirk Draper. I'm the president and CEO of the Colorado Springs Chamber and EDC, and we're really glad you joined us today for our Chamber Connect. We're going to do an unusual program today. In these days of addressing business challenges creatively, we're trying something new. We're combining our Chamber Connect with a virtual ribbon cutting for Kaiser Permanente. I'll come back to that in just a minute. But this is the first time we've done that. As you have had to adapt your businesses, we have as well. And opening a new facility like Kaiser Permanente is doing clearly comes with challenges that a normal in-person event just doesn't have to face. The mingling that usually comes with such celebratory events and just the atmosphere that we like to have at ribbon cuttings. Hopefully you'll experience some of that as you feel Kaiser Permanente's excitement about their new facility. When they threw out the idea, when Kaiser Permanente approached us about the prospect of doing a combined event, we thought it was a great idea, particularly when we saw the subject matter expertise that we'll be offering you today as well. Let's start then with our ribbon cutting. We'll go to a pre-recorded session celebrating some positive news about growth and expansion in our Colorado Springs market, and how Kaiser Permanente is growing their ability to serve our region. This event and the video is just another example of flexibility, adaptability we've all embraced this year. As you'll see in the video, some speakers filmed alone from their home and others did it with a film crew and so are masked up. So that explains some of the differences in perspective you'll see. Now, watch the video. I'll give you a few chamber updates and we'll go to our speaker today.
Hi, I'm Mike Ramsire, president of Kaiser Permanente, Colorado. I'm pleased to welcome you to this virtual ribbon cutting for our new premier medical office in Colorado Springs that opens this Monday, February 8th. Kaiser Permanente has been a market leader in Colorado's healthcare industry for 5 decades, and in 1997, we expanded to Colorado Springs. With the opening of this new medical facility, we operate 30 medical offices along the Front Range. This new facility is our 5th in Southern Colorado. Because our membership has grown and the population has been booming in Southern Colorado, we made an investment with this facility to ensure our members have more access to our high-quality, affordable care. It's hard to believe construction started on this medical office less than a year ago. We are grateful for all the hard work that has gone into this facility. And on that note, I'd like to take a moment to recognize the Kaiser Permanente staff who've played a major role in this project. From operations to facilities to our care team, thank you. To the City of Colorado Springs, including the City Council and the Planning Commissioners, the Pikes Peak Regional Building Department, and the Colorado Springs Fire Department, we say thank you as well. And now I hand it over to my colleague, Dr. Margaret Ferguson, who is the President and Executive Director of the Colorado Permanente Medical Group and is a pediatric hospitalist physician. Thank you for attending. We're all in this together.
On behalf of the more than 1,200 Colorado Permanente Medical Group physicians providing care to Coloradans along the Front Range, I share Mike's excitement for the opening of this facility that will better serve our members. Like most of our other medical offices, this 25,000 square foot facility will have primary and specialty care, as well as infusion, lab, pharmacy, and medical imaging all under one roof. And to support our nonprofit mission of caring not only for our members, but our communities, we invest resources and time to improve the health of all Coloradans. We look forward to seeing you all soon at Kaiser Permanente. Hope you all stay safe, especially during these times, and get vaccinated soon.
Hello, and thank you for the opportunity to be part of this virtual event. I celebrate the opening of this new and impressive healthcare facility along with all of you. Kaiser Permanente has long been part of our city, serving Southern Colorado since 1997. During a time when many cities are experiencing a shortage of primary health care providers, we're fortunate to witness this expansion that brings more opportunities for people to receive high-quality, compassionate care. The City of Colorado Springs will benefit from this addition, which helps create a healthy community where we all want to live, work, and play.
Hello everyone, I'm Jonathan Liebert, CEO of the Better Business Bureau of Southern Colorado, and welcome to the Kaiser Permanente ribbon cutting ceremony coming to you live from my home. Early last year, it was my pleasure to attend the last construction ceremony, although that was way more fun because I had a sledgehammer in hand, and today I just have scissors. Since 2016, our BBB staff has trusted Kaiser Permanente with our healthcare needs, and we've enjoyed working alongside the local team here in Colorado Springs, ensuring that our employees receive the best, highest quality care available from Kaiser Permanente. As a mission-driven organization, we believe in businesses that serve our community. We have found that Kaiser Permanente is dedicated to their mission to help improve the health of their members and communities they serve. Kaiser Permanente has also partnered with us to provide education during the pandemic to the business community through our BBB Working Safer pledge. The education that Kaiser Permanente helped to ensure businesses continue to operate safely in our community. Thank you to Kaiser Permanente for your continued commitment to Colorado Springs, its community and businesses, as well as the people who work, live, and play here. On behalf of the Better Business Bureau of Southern Colorado, congratulations to you on your grand opening.
On behalf of the Colorado Springs Chamber of Commerce and Economic Development Corp., I'm thrilled to be here today with you all virtually to celebrate some positive news about the impact this new facility brings to our business community. Kaiser Permanente has been a longtime supporter of the Chamber and EDC. We've valued their local presence in our community for more than 20 years. We know the pandemic has been challenging for everyone, including our local businesses, whose vitality and success are crucial to ensuring the vibrancy of our business community. Many businesses have experienced hardships this past year, but continued local growth and building projects like the opening of this facility are essential to bringing new jobs to our community. This project alone employed more than 200 people to renovate the facility, including more than 130 from one of our local contractors, Bryan Construction. Congratulations, Kaiser Permanente, on your expansion, on how you give back to the community, and having confidence to make this investment in Colorado Springs.
That's creative approaches, what we need to do these days. Congratulations again to the entire Kaiser Permanente team for your success that leads to this expansion and the confidence in the community to make this investment now. We're really grateful for that, and we wish you nothing but success. Now, a few chamber updates. Just want to make you aware that businesses in El Paso County now are eligible to apply to participate in the 5-star certification program. This was announced yesterday. We launched it officially. Businesses that are certified are able to operate at one level below our place on the COVID dial. For example, we're in orange right now, but 5-star certified businesses can operate at level yellow. The program is being brought to you by El Paso County, City of Colorado Springs, the Chamber and EDC, Public Health, and other community partners. And we're just very pleased to be able to operate this, to be able to offer this. To become certified, businesses will prepare an application and a management plan describing how you'll operate safely to protect your employees and your visitors' health, and you'll allow a vendor to the county to inspect your business for compliance. There's information on the 5-star program with applications, templates, and guidance at our website. Let me put that in the chat. At our website. And there you'll find that there, more information there, or if you'll Google Chamber and 5-star program El Paso County, we'll find that, and look forward to hearing from you. I've heard from businesses this morning who already have applied, and we're looking forward to helping alleviate some of the obstacles to open operations that we've had. Second announcement I've got for you is to let you know that our annual report for 2020 was published just last week. It's a good summary of our work at the Chamber and EDC. We want to keep you informed of work that we're doing in the community. We hope you'll take a look. You can find it here. Let me post this in the chat here in just a second, and hope you'll take a look there. We have hard copies available as well. That's for the Chamber's copy of our annual report, just posted there. And finally, I want to share with you a few upcoming events. On Tuesday, February 9th at 9 a.m. is our next installment of our business briefings with Uccs. That's where we pair a member of faculty with a member from the business community. And the topic this time is navigating through communications. Speakers are Matt Lyle, who's an assistant professor of management at Uccs College of Business, and Jamie Fabos, the chief communications officer at the city of Colorado Springs. Thursday, February 18th at 12 noon is our next Chamber Connect program. And that's why childcare solutions matter to your business. Important topic anytime, especially so during the constraints we have during the pandemic. And then on Thursday, February 25th, last week of this month at 11 a.m., we'll host the State of the State. The Chamber and EDC is proud to host Governor Jared Polis to share his report on the state, both looking back to 2020 and looking ahead in 2021. All three of those are virtual events. We hope you'll join us. And now let's turn to our program. It's a real privilege to introduce today's keynote speaker, our program for the Chamber Connect, and it's Tom Carter. Tom is the Vice President of Kaiser Permanente's Workforce Health Consulting and Customer Support. He's been with Kaiser Permanente for more than 15 years, leading sales and advisor relations. Prior to Kaiser Permanente, Tom spent 12 years at Lifeguard, a nonprofit regional health plan in San Jose, California, where he was the Vice President of Sales, Marketing, and Product Management. He also spent 3 years at US Behavioral Health as Vice President of Sales and Marketing, where he focused on working with large commercial carriers, Fortune 500 companies. And he spent 7 years at Blue Cross of Northern California. You can see from those experiences deep expertise in the healthcare industry and broad perspective from multiple employers in different geographies where he's worked. Before I hand it over to Tom, though, let's watch a quick video, about 30 seconds, about their new premier medical offices. Here you go. Enjoy this.
Great. So thanks, Dirk, for those opening remarks. And, these are stressful times, incredible times. We've never been in situations like this before. But yet, as we look at what's going on, and we are so thankful that we're able to invest in communities like Colorado Springs and the areas there to continue to focus on health, population health, our community health. And what we'll talk about today is how all these things interrelate. And the chance for us to rethink the way we partner and the opportunities to, embrace our community health agenda. There's never been a better time, just because we have to focus on something positive. At least I'm the guy with the glass half full. So I always look for where we should be spending our energy. So again, congratulations to the community for this new addition that Kaiser Permanente will be bringing you. And as far as access and our health and our Permanente medical care. So today, the impact of COVID and it's exposed certain things, and especially these social agenda, plus the areas that are deprived geographically for all sorts of reasons, which we'll go into today. And so that's also kind of lit a fire under how are these communities able to manage their health and well-being when they don't have access or don't have resources that other communities do. And we're starting to see the risks show up, and COVID was an unfortunate situation where, COVID, the impact of the pandemic in those communities that are under-resourced is incredibly larger than communities where there's a balanced resource pool. So we have to do something. They can't just keep thinking this is going to go away. And so it's an opportunity for us to talk about it, educate ourselves, figure out what we can do differently, and then, kind of move ahead. And we've overcome big problems in the past, and we can address this together as well. So on the next slide, you can just write this down on a piece of paper in front of you, or keep it in your head, whatever you'd like. But this question is about clinical care is attributable to what percentage of an individual's overall health outcome. So how much of my health and my health and well-being is directly attributed to the clinical care part. What percent? You can pick any one of these. And on the next slide, you'll see, I don't know how many of you picked 40%, the healthcare is 20%, but what was surprising and starting to continue to jump out is, and you may have heard about the topic social determinants of health. We refer to them as social drivers because we don't think, where you live actually is going to determine your health. It's going to impact and drive it if we don't modify it some way. But so social drivers for us addresses the social determinant issue. And what they say now is your zip code is a better predictor of your health, overall health status than your genetic code. And so if that's true, and now the percentages are starting to weigh that out, we spend a lot of time worrying about the cost of healthcare, which we are incredibly focused on. We have to continue to focus on that and reduce that overall cost of healthcare. But all of these things are connected. And so we have to make sure we're doing something in every one of these areas. In fact, Healthy Behaviors, the area I run, which is the Workforce Health Consulting Group, we created that consulting practice because after meeting with organizations like yourself and customers out there, they were struggling on what does it take to keep a healthy, safe, and productive workforce, and the emphasis on healthy. It wasn't giving everybody a Fitbit running around. It was balancing health and well-being agendas. And so, but again, 30% of your behaviors actually drive 80% of the chronic conditions. So there's also a link back to the cost side. So all of these things have to come into balance. And we have to make sure that we're investing in each of these areas so that we protect the community and the workers' health overall. So on the next page, this sort of summarizes the three things that really we have to have an agenda on. We want to participate in that. We have an agenda that we're very proud to put out there as well around the focus on community health. And so we talk a lot about physical health and nutrition, that was a big thing. If we can get people to move more and eat better, everything will be fine. Yes, part of it. Mental health. We have a huge commitment and focus on destigmatizing mental health. The head is connected to the body. And we have to start thinking about screening. So we've changed the way that we engage and support our members because we started to screen for things around mental health when they came in maybe for a physical health ailment that we were addressing. We have to start thinking that way and finding out because the mental health now, as it's deteriorating, especially with the pandemic, we have seen depression and anxiety and other things start to come out of that. So there's a correlation, and then it shows up in your feeling, how you feel, or your actual physical health starts to deteriorate. So these things are really important to make sure that we understand them and start to address them. And then, of course, the social health, which we're going to talk about a little more deeper today. So on the next page, you'll see that it's this overall cost is really an impact that you can't ignore as well, and it shows up in our workplaces and from our communities. And so 1 in 4 Americans, which really was surprising to me, have had an unmet social need, and that's in the commercial business. That's not just Medicaid population or certain low resourced areas. This is in general. And so, you can imagine at any one time, somebody is struggling with one of these things. We know in our population, when we look at our employees, there are people that from time to time do not have a home to live in. It's not that they're homeless. They've just had an event in their life and they don't have a home to live in right now. So we know it shows up in every community and every workplace. And so just being able to think about that in a way that feels like we're giving people access to resources to help if this were to occur, how would people get help? And us as employers as well as community leaders, we have to make sure that in both cases we're delivering those resources and making them educating people on them and making them public and accessible. And there's some exciting new ways to think about doing that. So it's a good time to address this more deeply. So on the next page, this is an example. This is an actual study, and this is the part I was telling you about. The zip code is a better predictor of your health status than your genetic code. You can see between the two zip codes, and these were the main differences: low-income communities, communities of color, communities with limited grocery stores, so they don't even have access to good food, healthy food. so you can't make the right choice. They don't have ways to get to medical care if they need it. So then everything becomes an emergency room visit or something much more costly and frankly isn't appropriate care. High density, multi-regional, multi-generational housing units, for sure. We have multi-families living together. We know that showed up very deeply in COVID, that those communities that had these kind of aspects very much have a higher rate of infection and impact. And then of course, the essential workers, especially with COVID, you can't, a lot of the essential workers are these low wage earners in some cases, and they're living in these communities that have all this risk. So all this stuff is very much impacted right now. And there's real impact to people's lives and our communities. So on the next page, this is sort of the ecosystem that, that we're trying to just make sure that there's an agenda here, that we know or understand our roles, that we're engaged, and that wherever these areas of concern or issues lie in any of these buckets, that we are connecting and communicating effectively, especially for our workers and for our communities, members living at home. So the economic stability piece, these are the kind of things that those are kind of the aspects when those things get out of tilt. You can see under neighborhood and physical environment, any of these things, again, get unsafe versus safe. It completely drives the rest of the risk. And you can see along here, hunger, if there's no access to food, period. COVID brought that up because, as you know, some kids, the only place they were eating lunch or eating during the day even were at schools. And when COVID hit and we locked our kids in, a lot of times we cut off a food source. And thank goodness the communities responded and schools began to say, we have the meal program, come by, pick up your meal and things like that. But that was another one, a disruptor where we cut off a food source in an area that was a very high risk for us. And then you can see the healthcare system, any of these things get out of kilter. If you have people not covered in healthcare, that's going to drive cost and poor health because people won't have access to healthcare. So we now have the Affordable Care Act and things like that to begin to address that. So you can see all these things sort of hang together and are tied to the overall health outcome that we're trying to achieve with our communities. So on the next page, another example, kind of a tale of two employees as we look at just the employee base. And you can see Monica, who lives in one neighborhood and doesn't have access to, has access to fresh food, good education, not a lot of crime, so it's safe to get out, walk around. You can be mobile, you can bike lanes and other things. And of course, there's just an environment that supports a healthy behaviors. And then of course, the opposite of that, doesn't have, long commute or poor access to public transportation. So they're struggling right out of the gate. Obviously the food choices are tough, high levels of crime. So there's a risk there, both stress and inability to sort of move around outside. And then of course you may have poor air quality. And again, the life expectancy drove, as these things were under normal there, you can see the life expectancy actually came to the same conclusion, which is it's going to impact somebody's life, their healthcare, their cost, their impact in their work life. They're trying to provide for their family. So we want to also protect it because they're bringing home a wage and they're earning for their family, and we don't want that to be impacted as well. So that's where my focus is our roles at supporting workers in the workplace, and we have lots of services, and are we making sure people have access to them at the right time? So on the next page, there are health rankings out there in the community. This is a sample of the health outcomes that you have in the Colorado Springs area. And the darker it is, that's the lower ranking, and the lighter it is, that's the better ranking. So the first one is the overall rankings in basic overall health outcomes. And the blue one are more about the social factors, the behaviors, and all of the other things that we know are impacting physical environment, clinical care, healthy behaviors is the blue one. So we do know where we think we might have hot spots or concerns that we should be asking ourselves, are we reaching everybody and making an impact everywhere, and not just areas where they have plenty of resources. So on the next page, it was actually just an example in the Pikes Peak region where United Way, and there was a community focus on trying to address this problem that they saw. And the percent of uninsured residents between the time they engaged, which was 2008, to 2015. So this was kind of the period of beginning to focus on risk factors and things they could impact. The uninsured residents went from 14 to 7. So they cut the uninsured rate by half, which is a huge number. And they could, so as you go back to that ecosystem I showed you earlier, where the ability to have health coverage was one of the risk factors, they addressed, they doubled down and addressed on that. The poverty level went to 10%. The average is 14% in the US. So again, brought that better, closer. They had the Affordability Index they were addressing, and it was the higher the better. So you have the Denver major area around Denver and Boulder, 129 and 118. So they were measuring that, and the index score came in at 166. So they addressed that as well. And then the challenges were Medicaid, number of people, almost 26% of them were enrolled in Medicaid. There were 33% of the residents lived in unaffordable housing, requiring more than 30% of the household income. So again, taking most of the income right into the housing. And so as they started to do that, also there were nutritional programs that doubled. They didn't know, people were not using them. So it went from 5% utilization to 10. So again, as you work your way across that ecosystem I laid out, this is a great example of the commitment in the community in this region where they started to focus together, and they made great impact, great strides. So there's a lot to learn, just kind of looking around and asking ourselves, who's been doing this? What have we learned? How can we help? And just join the cause. So on the next page is we've begun, so with Kaiser Permanente, we obviously are a healthcare system and also providing the insurance to access that very unique Permanente medical care. And so we started to ask ourselves, how are we looking at the employees and members that we cover on behalf of our employers? And so we started to create similar heat maps that you just saw on the public one. And we looked at from the most deprived area to the least deprived area, same thing, lighter the better, darker the worse. And then we started to provide, in this report, you have to have about 250 or so employees to run this report, but we also find ways to aggregate it for communities. So as we get our membership continues to grow, we can start looking at some areas where we may want to suggest to an employer that partnering with us, or to a community, it looks like these are areas that have these sorts of issues, then we can sort of contribute towards that data. So you can assess where you want to put the effort. This is not, you can't shotgun this. This is not peanut butter. And, this is focused laser, because we only have so much resources to make sure that we're addressing the right areas. So on the next page, some of the data we have, there's 2 or 3 different pages of data, but I just pulled this one out as an example. So what we did is we have a lot of information about the health care and the health status and behaviors of those members. And so, so you can see here the blood pressure control is a big predictor of downstream risk and cost. And you can see that it's much worse in those deprived areas versus the very lighter region at the bottom is only 3.7% are outside the average, when in fact, all of the risk is in these other areas. So again, are we communicating in a way that can we identify if that's a unique population that we should be communicating differently with, or making sure that they know how to access their healthcare or things to help them control these kinds of risk factors. And then same thing, depression prevalence. You can see that, is there something going on in this zip code in these areas that we would address? Same thing with the risk factors on high cholesterol. It's interesting, this has happened in every one of these I've run. The area with the most resources always has the highest cholesterol. So they're eating well and drinking well in those areas, and it shows up in their healthcare scores that it's always way out there on cholesterol. So we all have things to manage in our lives. And then of course, smoking rates, which is a big driver. And I know in your communities, smoking has been a big focus, and you have tremendous progress on average, but you can see that there are pockets that still have to be addressed. And are we addressing them or not? Behavior change is tough. So it's not like we can come in and wave a flag and people are going to change. It's more about, do people understand the resources available to them? Do they understand their risks? How would they take personal responsibility to take care of that risk factor themselves and things like that? And I think us as partners, you as your business, those of you that have Kaiser Permanente or will have Kaiser Permanente, as a business partner, we want to help uncover these opportunities to support our workers, because a healthy worker is a healthy business as well. So there's a business agenda here, and there's also the community health agenda, and they're coming together, which I think is a great thing. So on the next page, there are some things you can do. And again, Kaiser Permanente, as your community business partner, we can contribute towards defining some of these things. And some of this is just linking you to resources that we know exist. So we're not trying to say everything has to be built at KP. We're looking for areas that already have the best toolkits or the best policies that have been sort of tried and tested. So you can see that, thinking about for healthy foods, I saw employers give, coupons. They made a deal with the store up the street or the healthy food option up the street, and they got them to give their employees coupons, right? You have to do that virtually right now, but, just thinking of, are there community partners where we could make it easier for people to make the right choice? And so I've seen people do that, where they have sort of a coupon program for their employees. Obviously, telecommuting options, you saw that 1 in 4 people are struggling with those basic needs. Transportation's one of them. And so a ride sharing program or telecommuting options, especially now where people are working from home, I think people are going to say, I'd rather work from home, or I'll leave the workplace. I saw some pretty staggering statistics about the percent of women that are thinking of leaving the workplace because they've been home now, and they're trading off the work-life balance thing. So there's obviously opportunity there to meet in the middle. Flexible scheduling, paid sick leave, EAP services. And it's kind of funny because, well, not funny, but it's the realization that all of these things are important right now, other than the carpool and ride sharing. But these incentives for public transportation for our essential workers, EAP services right now, a high percentage of people don't even know if mental health benefits are covered under their health plan, because it's been so stigmatized over the years. People didn't talk about it. Nobody wanted to access it in the healthcare system. Maybe they did it outside so that it wasn't in their medical record. And that's got to stop. And we're very much committed to destigmatizing mental health as it relates to getting people to get treatment. And so EAP services have always been thought of as, if you have a drinking problem or if you're depressed, call the EAP, or if you're in trouble at work, sometimes you have to call EAP. So all of those things, I saw an employer change their EAP services hotline to a concierge service and remarketed it to their employees, and the utilization went off the charts. And it was very specific, concierge for your health or mental health. And they just rebranded it. And I thought that was brilliant. They didn't change anything but the communication. And then, just the biggest thing, as you think about how do I start this journey, involve whoever is you're trying to partner with. So you're trying to partner with your workers. So figuring out a way to survey them, engage them. If you're a small employer, you can bring people together and start to talk about, are there things we should be doing that we're not doing to address the well-being of our communities and our workers. And believe me, things are going to boil up quickly. These are some buckets that may show up that you could say, oh, well, there's things we can do about that. Same thing with us. Kaiser Permanente is ready to engage with our communities. We've been doing it for 50 years in Colorado and 75 since our inception. And we understand what it means to partner and then to integrate. The integration is the value improving outcomes. And so if we think about how we could integrate our approaches and think differently on handoffs and everything, we can move some of these things and get our workers, protect our workers' health and well-being. So on the next page, the other things that you can do is focus on strategy. So the area that I lead, and I came from the sales and broker relations side of the healthcare business. So I was quote unquote selling health benefits and insurance for most of my career. And when I came over to Kaiser Permanente, it was an eye-opening because it's healthcare and it's outcomes, and that is connected to insurance. But I had never worked with a high quality healthcare organization like the Permanente Medical Group. And I learned all sorts of things around, workforce health, and you need strategies to impact risk, which will drive. And it was nothing about benefit strategies and price and which product you buy. It was all about, you need a business strategy to address and manage the health, safety, and productivity of your workforce. And that incorporates your health care and your health benefits. and you want to think of your partners as demonstrating that. Can you tell me what you do to keep my workers, when they enroll in your program, healthy and safe? And they'll be productive if they're healthy and safe. And so we feel an obligation to be able to do that. And we have our workforce health consultants and others who can give strategies and demonstrations of how we all could be engaging to support our workers. And so there is a workforce health strategy component to this. And if you don't have one, if you have a benefit strategy, but not a workforce health strategy, it's very easy to fill that in. And then it kind of changes how you think about your benefit strategy. So that's a big one. And Kaiser Permanente is here to help you with that as well. Obviously, we talked about the EAPs and the social support and other things within that you already have maybe access to in your communities. The financial health is a big one right now for obvious reasons with the pandemic. And making sure that whether what your community benefits are that are available for those sort of financial things, and also being able to think about if you have 401k vendors or other people that maybe are offering your workers some benefits around financial planning or financial benefits. Sometimes they have services that are underutilized or underpromoted. So just thinking about financial health is a really big area right now, which is driving depression and mental health issues as well. So again, all these things are interconnected. So think about the financial aspect, and maybe there's some resources in front of you as an employer or as a community that you could promote better. And then the social needs is all about workplace policies, and we've talked a lot about that. So this is a sample of in our reporting of we give suggestions along the way, not just give you the data, but actually say here's what you can do about it if you want to begin to address this. So on the next page again, some of the other areas that we've seen work with other employers and other communities. We've talked about just the partnership, I think is the best part, because we may be all together, but we're not holding hands. It's one of those things. We're all sitting at the table together, but I don't think we're connecting as well as we could. So great opportunity to redefine what partnerships look like. The volunteer strategy was always something important to Kaiser Permanente and as an employee. I love the way that we've created volunteer opportunities to give back to communities. And it's part of your well-being, is the feeling like you've given back and helping others. And so if you have a volunteer strategy, is the volunteer work focused on areas that need the most help? It's just a question that says, if you have one, great, but is it directed, or is it just kind of a random volunteer program? Or you can create one. And people like to help others, and it's really good for employer-employee relations that you're helping me give back to the community. Sometimes I don't know where I'm most needed, so that's an easy one as well. And then of course, certain supporting in your communities and through the chamber and all the work that you guys do in community policy, governmental policy, support the policy changes that are needed to address some of these things. We work with Heal Cities, which is Healthy Eating, Active Living. And it's a city program that we joined that partnership and have been working with the cities for years on what's a healthy city look like, and things like that. So, and some of those need policy changes in cities to you make these changes. And so there's different things. You can sort of pick one to start with, and then sort of start to be curious around some of these areas. So on the next page, these, again, examples of in our communities right now, and you have a wonderful one that's been around for a while, ENT, and the whole commitment they've done in pediatric health and mental health areas, and they continue to make investments in your communities, and then just local Starbucks, food banks, and you can just see that these are a very small sample of local and national people that are in our communities today, everywhere, and what they're starting to do to try to make a connection to this problem. And so again, this is where the chamber has provided a great starting point about sort of introducing this and then saying, if there's an agenda here, maybe we can start to form one. So on the next page, this is Kaiser Permanente's agenda. So we obviously have significant commitments around food for life. So we have these are all programs that we can describe that are out there addressing some of these things. Thriving schools, in support of our schools, both the employee, the teacher, and the student. City Health I described. Unite Colorado is all about those deprived areas and social services, and how are we finding ways to make those connections. And if I have a member in our healthcare system and they're homeless, and I know that, and I've screened for that before they leave, what are we doing to not let them leave it without making a connection? And so for us, we want to be able to say, here's the phone number to call, or let me call it for you, and let's make sure you have a place to stay right now. So there's a bunch of programs that are going on that for us, it's called Unite Colorado, and it'll be launching going forward this year. There's housing as health. So we have commitments in a lot of different communities around trying to invest in reducing the homelessness and and joining local partners to contribute towards that cause. Obviously, we've had a long time commitment on environmental stewardship, and we continue to lead many developments in that area. Obviously, continue to invest in our communities through grants and other investments has just been part of our DNA since we've started. And then we have a huge research arm, because a lot of what you see us talking about now has come from us studying what's impacting our community health. And we have an immense amount of data because we've been in business a long time. We've seen a lot of things. We've experienced a lot of things. And we can uncover where those risk factors might be, and we can then serve them up to the communities and to our business partners like yourselves to figure out how we can address this together. Because, kind of pointing to one person and saying it's the government or it's the healthcare system that needs to fix it, that's the easy out. But thinking about, okay, if we own this problem, then what are we going to do about it? So we have a lot of programs that again, could be used in communication and engagement with our communities, make sure they're being fully utilized. And on the next page is just the way that Unite Colorado is going to feel. So I mentioned as an example, someone saying, well, I don't actually have a place to stay tonight, and we're about to let them out the door. There's now going to be a hub that will connect to all the community resources, because some community resources are full, frankly, and you don't want to send someone and they say there's no room at the inn. So a lot of this community resource management is to make sure that when we do make referrals, that we know that these organizations can accept a referral. And so that's part of it. There's never really been anything before like this. And so again, we are partnering with the communities to make sure that those resources are being managed. So there's going to be a hub that organizes that. And then we get them into the referral system. And then you have the data to inform what that social ecosystem is suffering most from, so that you can close that gap. And again, not peanut butter or shotgun it, but to actually use the data through, we now know that someone didn't have a place to stay. We referred them, we got them a place to stay. What happened? And we can see a whole bunch of different aspects of the impact of that. And that data is very valuable, because then we can go back and say, okay, let's do more of this and less of that. So it's a great opportunity, and we're very excited about launching this in every region that we're in. So, and Colorado is going to be in 2021. So, and I think it's March of 21. So it's early, it's coming soon. So on the next page is a little video, I think, that we're going to run.
We're listening for more than just your heartbeat. We know it's hard to be healthy without a safe home, enough money, healthy meals, and relationships with people you care for and trust. If you're worried about these important basic needs, we want to know. We can help you find the resources you need. At Kaiser Permanente, we believe health is more than health care, and we're here to help.
So there's just a nice way of sort of laying out what I was describing, which is, we just have to think differently about how we're engaging and connecting, and so that we can manage the total health of an individual, bigger than just their mental and physical, but starting to think about the social health as well. So on the next page, some more connections to some resources for you. So we can get you, if you go to the kp.org /choose better site. This is where you will find these resources, or reach out to us and we can make sure to get you what you need. We've made an investment, and again, thinking about what we know, what we've learned. We're a huge healthcare system and have been in the middle of this mess with the pandemic. There was things we were learning every single day, if not every single hour, as it was unfolding, up to and including what does it mean to have a safe and healthy work environment, getting back to work. So we had so many questions from customers about what do I do? What do I do? What do I do next? Do I change the environment, or do I let people work from home? Or if I have to bring them back, how do I bring them back safely? So we've invested in this change. We update this about every 2 to 3 weeks. We've invested in a playbook of planning for the next normal. And it's basically chapter by chapter. How do you bring your workforce back to work safely? Whatever that means. Back to work could be virtual, or it could be back to the physical environment. So it's a very valuable book, and so there's a chapter in there, chapter 4, on social on the social health needs. So we put a chapter in there, a lot of what I've been describing today. So you'll have the resource center. Also, if stress ends up being, as you understand and engage and collect information from your workers directly, surveys or just data, stress management, sleep, these are things that people are suffering from right now. And there's toolkits here of how to think about deploying that with your workforce and how you can promote Kaiser Permanente's resources and others to address some of those issues. So we try to create toolkits, again, based on customers asking us, this is what's driving my risk and I don't have a way to, what do I communicate with them about stress management? And yes, they have a role in it too as an employer. I can't just treat it. And then lastly, I think there's additional resources. And so more toolkits, how to get involved. So these are community programs that you can also click through. And so there's lots of, when you want to start the journey, there's assess the situation, spend time understanding what's going on and what you know. And then think about, if I were to do something, what would I do first? So kind of sketching out a plan. Engage, so begin to engage on a topic or in a population or some activity or behavior change you're trying to address. So keep it really simple. You don't have to, design 18 things and implement 14 of 18. Try 1 or 2 things that are obvious, but work it all the way through from assessing it. Yes, it's a problem. I need a plan. I have someone help me build a plan. I need to do an engagement. So this is the behavior change we're going for, and here's how we're going to engage with our workers or our community health partners. And then what are we going to measure to determine if it was successful or not? And you have to make sure to do that not after, but during what those measurement issues. And then you can look at and you saw what happened in Pikes Peak area was they had numbers they were specifically trying to address and they impacted them significantly. So that's a great example of assess, plan, engage, and measure. And again, I think there's lots of people here who want to help our community stay healthy, mentally as well as physically. So I think do I have one more? So I hope you found that useful. I think we may have time for if there's any questions or on some of this.
Just standing by, Tom. Thank you. I appreciated your first question. Just a comment. I appreciated your first question. When so many of us think about healthcare, we think about doctors and hospitals and clinics. And just from the opening, you set a very good context for us to consider our health in a very different framework than we normally look at it. Thank you for doing so.
Yeah, good. Excellent. Any other? I think if I had any, I think I said this earlier, but just be curious. A lot of people can look at this and think it's pretty overwhelming, which was my first reaction. That really, do I have it? How do I address this? And it's just being curious and starting to assess, is there a problem I might be able to address? Or is there a problem I didn't know I needed to address? Like when we started this journey with our own workers years ago, I remember listening to people saying, I had no idea that I had nurses on staff who were living out of their car. Maybe a divorce or a partner breakup or something caused them not to have a place to live. And without us activating the caring muscle, you know, you're not curious and you don't ask. But when you start to be curious and you start to sort of ask the right questions with both our community partners and our own workers, usually it'll rise to the top, or someone might speak, a peer might speak for somebody else. I know this person's struggling, they don't want to talk about it. So confidentiality always is something people want to protect as well. But when you become curious, you will either feel confident that everything is cool, or you'll identify areas that are open for engagement.
Well, let's do this. Tom, I'm going to say thank you. Let's go ahead and wrap our program today. Thank you so much for sharing the depth of your experience and the breadth of experience in what you shared with us, how that's changing and opportunities and the challenges in today's world.
Great. Well, it was my pleasure. And again, we all can join the cause and help each other. So I appreciate the opportunity.
Kaiser Permanente has been an important part of our community, and particularly the fabric of our healthcare community here for decades. And we just appreciate your support for the Colorado Springs region. Thank you for that.
Great.
Folks on the line, I hope you've enjoyed today's program, today's Chamber Connect. I hope you found that helpful and informative. And we also hope to see you in 2 weeks. Our next topic on February 18th will be on child care solutions for your business. Again, one that's particularly relevant in today's environment. Have a good afternoon. We are adjourned for today.